Welcome to Great Minds with Lost&Found, the podcast that connects people and reimagines systems to improve mental health for youth and young adults. I'm your host, Joel Kaskinen. Lost&Found is a comprehensive nonprofit organization that aims to do more to eliminate suicide for youth and young adults in the United States. Now that you know who we are and what we're all about, let's get to the show. Right. Hello, and welcome back to the Great Minds podcast with Lost&Found. I'm your host, Joel Kaskinen, and today sitting with me, I have our incredible friend and partner, Janet Kittams. Correct me if I'm wrong, your title is Executive Director of the Helpline Center, correct?
Close, but I'm CEO.
CEO, okay. Yes. Got it wrong. I'm off to a great start this month.
That's fine.
CEO. Okay. Everyone does it a little bit different.
Yeah.
Some people are CEOs, some people are executive directors or administrative director, whatever. Anywho, I'm here to talk to you today specifically about the tasks that you all do, the services and offerings that you provide through the Helpline Center. I really want to dive into the new 988, the national rollout of that, and how that is helping to influence the world of suicide prevention. So Janet, if you would just go ahead and introduce yourself, if you wouldn't mind sharing who you are, how you got your start with Helpline, and what your role as CEO is.
Yes. So I have been with the Helpline Center for 26 years overall. So long tenure. I had a break there for a little bit where I left and came back again, but I've been CEO for the past 12 years. I actually started as a volunteer a long time ago. My history is I'm a licensed professional counselor. So when I was working in the field, I had an opportunity to volunteer to answer the helpline. So I did that and really enjoyed it. And that's what kind of led me into the path of working at the Helpline Center full time. Yeah.
That's amazing. So the Helpline Center, obviously, you offer a ton of different services. It's a wide array. It is not just the, helpline call center. You offer a ton of different things. So let's start there. I want to kind of tie everything into suicide prevention specifically. So right now, our podcast series is exploring the CDC's 7 strategies for suicide prevention. One of those strategies is improving access and delivery of suicide care. So I'm really curious about how the Helpline Center does that, because my work with you, I know that you do that very well. So that's why we've invited you to talk today. So can you share with us what the Helpline Center does, and the services specifically that you provide that contribute to suicide prevention?
Sure. Yes, the Helpline Center has a wide range of programs and services, but I'll focus mostly on what we do for suicide prevention work. So clearly we have our point of contact, our crisis line, which just changed over to 988 on July 16th. So that operates 24 hours a day, and it's a call, text, or chat service for people who are struggling themselves with a crisis. It might be suicide crisis, depression, anxiety, might also be a family crisis that they're having, or a substance use crisis. So we get calls, texts, and chats on all of those issues. So that certainly makes accessing support and resources available 24/7. Some of the other services we do for suicide prevention include trainings. We do a lot of suicide prevention trainings for the general public and for mental health professionals, everything from an hour training all the way up to a 2-day training to kind of recognize signs and symptoms, and then what are the next steps to take to help that person. And then we do a lot with our survivor grief support services. So those family and friends that have lost a loved one to suicide, we're there to support either through visits personally, over the phone, or through our support groups or literature and materials that we send out to them. And that's available all over the state of South Dakota. We certainly want those family and friends to know that they're not left behind and they're not alone. There are other people going through that same grief process, and we're here to support you, listen to you, and walk alongside of you on that journey.
That's incredible. So we work very closely with you with Lost&Found. Obviously, we're both in that space of suicide prevention. You all lead the suicide prevention task force that we sit on at the city level. So obviously there's tons of different entities that work together, and it's a really cool collaborative effort to provide suicide prevention and mental health support. I personally think we're getting to a space in South Dakota where we have these wide range of offerings now, which it has not been the case in the past. So I think that the national rollout of 988 is really, really helping. And so that's kind of why I wanted to talk a little bit more about this today. So the national rollout of the 988 Suicide and Crisis Lifeline does mark a huge milestone
Mhm.
for mental health and suicide care in South Dakota, but also for the ecosystem at large nationally. So, how is 988 improving access and delivery of care specifically in South Dakota? What does that look like?
You know, the Helpline Center has answered the National Suicide Prevention Line since that was unveiled back in the early 2000s. And so it was just difficult to market that, quite honestly, because it's a 1-800 number that you have to remember all those digits when you're in crisis and just not that easy to do.
Yeah,
So we were super excited when the talk came around to developing a 3-digit phone number for that crisis line. So when it launched on July 16th, we honestly didn't know what to expect. You know, how were people going to respond to this? Was there going to be any confusion? Would they latch onto it? Would they still want to use the 1-800 number? And so we have been very pleasantly surprised that people just have adapted and have been utilizing the service quite often. And I think that's because it just makes sense. You know, we're so understanding of like what 911 does, and
yeah,
people in South Dakota know about 211. And so it made sense to introduce 988 for
yeah.
the mental health crisis, suicide crisis, those kinds of issues. And I think adding in the text and chat element has just really expanded the service, because I think there's a portion of our population that that's how they prefer to communicate. It's just by texting or chatting with us. And so that's opened up a whole nother world to reach people. So we're really pleased to see that. So I think that in itself has created an access point that we didn't previously have before.
That's so cool. Now, I'm just personally curious as a young person and as a digital native. I'm curious, have the text and chat features been primarily with a younger demographic, or have you seen that being utilized by older people too, or what's that looking like?
You know, the chat is predominantly our younger population, I would say teen, young adult that we see mostly with that. The text trends more young, but we do see some adults using the text
Oh,
kind of
cool.
conversation feature. Yeah.
And with the calling feature, is that more older demographics then?
Yes, although I will say with our calls that we do see the gamut, everything from, you know, young folks, teens, all the way up to people who are over the age of 80. So really we
Wow,
just cover
okay.
the whole spread.
Yeah, no, I'm just curious about that because I look at running our social media,
Oh,
our
yeah.
podcast, and all of that jazz. So all of the data that I look at regularly points to the younger demographics
Mhm.
are using those spaces. So
Yep.
when you just said that there's certain populations that use your text or chat features more,
Yeah.
I kind of got wondering. So, and especially with Lost and Found, we serve youth and young adults.
Yeah.
So I was curious about that too.
Yes.
Perfect. That's so cool. So can you talk us through what people should expect when they call 988? What does that look like?
Absolutely. So when they call it, because it's a national platform, you'll get a national message when you first call 988, which everybody across the country hears the same thing. Gives you an option that if you are Spanish speaking, you can press a different number to get somebody who is
That's
speaking
great.
Spanish. And specifically, if you're a veteran, you can also receive veteran services. But if you just remain on the line, it will get transferred to your local crisis center. And so folks who call from area code 605, they will all come to the Helpline Center. So then once the call is transferred to us, we just simply answer it, and then we kind of ask what's happening with them that day and have them kind of walk through what prompted them to call. What are they struggling with? What are they worried about? What's happening in their life? So we kind of just establish a rapport, get to know the person, find out what's happening with them. And then we also do what we call a risk assessment or a safety assessment, just to kind of figure out, is this person in immediate danger?
Mhm.
What kind of steps do we need to take to make sure they stay safe? So we determine that, and then we start developing what we call a safety plan with them to make sure that whether that's, you know, making sure they have connections with people around them that care and love and support them,
Totally.
whether they have connections with a mental health provider. Maybe that's a counselor, a case manager, a family practice doc, a psychiatrist, whoever might be there to support them through this journey of recovery from that crisis that they're going through. So we develop that safety plan, and the vast majority of the time, we kind of are able to kind of stabilize them, wrap up the phone call, ask for their consent to make another follow-up phone call, and then we'll follow up and call them back within the next 24 to 72 hours and check in with them again and see how they're doing. For the small percentage of time where they're not stabilized by the end of the call, and we're concerned about about them, we will connect with local law enforcement to do a well person check with them. But that's only about, I think, 7% of our phone calls. So
Okay.
it is a very small percent that we just really feel like, hey, we really need to have somebody go out and be with them and check on them, that kind of thing. So the text and the chat is a little bit of a different system. It's still a national platform. You can literally text anything to 988 and it will get through to the 988 system. So once you are into the texting system, it'll ask you just a series of questions, just some initial prompts to kind of find out a little bit more about why you're texting 988. So you just reply to those. And once again, if that text is originating from the area code of 605, get routed to us, and then we'll just take it from there and start texting and communicating back and forth. For the chat, it's a similar kind of experience. That's obviously online. So you can connect through the Helpline Center website, helplincenter.org /988. And you just click on that. It'll ask you a series of prompt questions. And then once you've completed the prompt questions, it comes to us through the technology system. And then we just start the conversation and talking with folks. And so follow the same kind of format as the phone call, but it just, it flows a little differently through text and chat, but same kind of concept.
That's really cool. So I'm curious about how the responses have been for the 7% of those that like aren't quite stable at the end of that phone call, that they're still in crisis. Y'all are concerned about them.
Yes.
When you dispatch local law enforcement, has the response been positive? Because some of the research and data shows that people in crisis would prefer not to have a local law enforcement entity responding. They'd rather have a mental health professional or a doctor or someone of care rather than law enforcement. I'm just personally curious about that, knowing our work.
Yeah.
Can you talk about what that looks like and what the response has been?
Yeah, so in that space, there are more models that are being developed. They're more prevalent across the country, but there's some starting of that in South Dakota.
Right.
More of what you would call like a co-responder model, where there might be a mental health professional that may accompany a law enforcement officer on that response call. And then there's also some models that don't involve law enforcement at all, that take more of a peer-based approach, maybe a peer who has been through a mental health crisis themselves, but's now in recovery, and maybe they bring along a social service provider with them. So I agree. There are many cases where it's not in the best interest of that person in crisis to have somebody who shows up who is in law enforcement, because that can be a little jarring and kind of can escalate the crisis at some point. So we're excited to watch the development of more of these models in South Dakota. So we have more options at 988 to kind of connect people when they're still in that crisis state. So right now, I don't have a lot of options available to us, but what we do on the phone with somebody when we know that, hey, this person's really going to need some additional support, we try to work with them what we call in a collaborative model, trying to get them to work with us and understand that, hey, we're really concerned about you right now, and we just want to make sure that you're okay. Is it okay with you if we contact law enforcement and we'll stay on the phone with you until they come? And then we just want to have them just make sure and check on you that you're okay. And so many of the times out of that 7%, it's that collaborative kind of approach. And they understand why we're doing it, and they understand that that person's there to kind of check on them. So that seems to have a very positive kind of outcome. There are a few cases where we're just not able to do that based upon where the person's at in their crisis state. They're just not willing or able to kind of open up and be ready to have somebody show up like that. And so sometimes those can be a little bit more difficult cases, but we always know that we want, first and foremost, that person to be safe. We don't want anything to happen to them. So we're going to try to ensure whatever route we have to take, that's what happens.
Definitely. Second follow-up question, I should have asked this first, actually. Your Helpline Center operators, your 988, the people that answer the phone, they're all trained. They know how to respond in crisis. They have a background in mental health. Talk us through what the credentialing looks like and what you have to go through in order to be an operator.
Yeah, absolutely. So when we started 988 back in July, we created it in such a way that it's very different than the staff that answer 211, which we've had for a long, long time. Our 211 staff are kind of bachelor level folks that are more experts in kind of resources and getting people connected to the right resources. Our 988 staff are those folks that have a master's degree, generally in social work or counseling or substance use, that kind of thing, in the behavioral health field. So they have kind of that expertise and experience that they bring in when they're answering the calls that allow them to, establish that kind of crisis counseling relationship with the person. And they understand how the behavioral health system works because it is kind of confusing, like who does what and
Yup,
what kind of
yup.
counselor do I need to see and what does the doctor do, and kind of walk them through that space so they're familiar with that. So those staff are just have a comfort level with handling crisis because they do that day in and day out. And there are all kinds of different crisis situations that arise. Certainly talking about suicide, but there's also kind of family crisis situations. We also end up handling calls regarding like child abuse and domestic violence and those kinds of calls. So my staff really have to be prepared on all levels of crisis to handle what might come forward.
That's great. Gotta love the trained professionals that
Yeah.
can do this kind of work because it's really not for the faint of heart.
No.
That's something that I've learned working in this field.
Yeah. Yes. Yeah. It can be tough work. It can be very rewarding because you
Mhm,
really feel like you're
absolutely.
making a difference in connecting with people. But sometimes it can be quite draining to do that day after day. So we do try to make an effort to take good care of our staff and encourage them to have good self-care
Yeah,
so that they can continue to help people.
totally. Well, let's step away from
Okay.
staffing for a bit. Some people might hesitate to call a lifeline.
Mhm.
Maybe they think, oh, that's for someone that's worse off than me. That's for someone who's really, truly in crisis. But in our 30 Days, 30 Stories project that we have annually during National Suicide Prevention Month, we heard from so many people that they wished that they'd called sooner. So, at what point should a person call 9888?
I think that was one of the encouraging things when 988 was launched. The previous 1-800 number had only been marketed for only suicide crisis. And so that's really all we heard about. With 988, it's a much more wide open platform for people to call. So we really talk with people about any kind of emotional distress if they're
Mhm.
feeling that it's okay to call us. And, the top three reasons why people have been calling us so far involve depression,
Okay.
anxiety, and family conflict.
Wow.
And
Okay.
so we're really seeing people, I think, reaching out when kind of that before it becomes a crisis state, but more like when I'm just kind of distressed about
Mhm.
it. So I think that's wonderful because we can get help for that person sooner so they don't have to go through that crisis period in their
Yeah.
life. So we're hopeful that as we continue to talk about 988 and encourage people to reach out when it begins, when they start feeling that distress before it becomes a crisis, that we can avert a couple of those different crisis
Yeah.
situations.
So kind of taking that upstream prevention approach.
Yes.
I love that. Great. Um, what challenges are you currently seeing in implementing the number, if any? One thing that we have heard might be a problem is having enough people to staff the call. I think that's just a trend overall in the behavioral
Yes.
health world, is just having the staffing structures in place to support the great needs that we're seeing nationally. So, what challenges are you seeing with the phone calls, with staffing, with just the overall implementation of 988?
Sure. I would say overall it's gone pretty smoothly, but of course there's always some hiccups along the way. And I think staffing is one of those, just because we're in a space, like you said, where there truly is a shortage of mental health
Yeah.
professionals out there. And so we're attracting, or we want to attract mental health professionals, but specifically who want to do their work either through a phone or through text or through chat, which is different than when you're working face to face with somebody. And so it's just a little more unique kind of look that we have for that mental health professional. So finding those right people has taken us longer than I think we thought, even though we knew it was going to be challenging. So, we still have just like one or two open positions that we're continuing to fill, but we've certainly been able to manage all the calls and the texts and the chats that have been coming in. And I think overall, the other challenge is kind of on the reverse. When we're talking with somebody and we want to get them connected with a mental health professional, sometimes we have to look at a wait time.
Yeah.
for them to get
Yeah.
in to see that professional. So we've adapted that and continue to do some follow-up phone calls to
Okay.
support them during that time before they can get in to see that mental health
Huh.
professional to kind of know that, hey, we're still here, we're still care about you, we want to check in with you. We know it's 2 weeks or 3 weeks before you can get in.
Yeah.
Yeah.
That's cool. I love that follow-up approach. I mean,
Mhm.
I know that that's what you do, in some of your other services.
Yes.
So it's cool to see that carry over into 988. Yeah. The Helpline Center obviously offers so much more than just the 988 crisis line. So kind of shifting gears from the suicide prevention, the crisis line. I'm curious if you would share some of the lesser known services and resources that you provide. I think some of our listeners probably
Mhm.
know of the Helpline Center and 211, but they might not know everything that you do. So,
Sure.
um, can you talk about things like financial assistance, support groups, community assistance? What other things are you offering that just the layperson in our community might be looking for?
Sure. I think through our 211 phone number, that's a great connecting point. So we have people who call us with all kinds of needs to get connected to resources. Financial assistance is a big one of those. And sometimes it's financial assistance to help pay for housing or rent assistance. Sometimes it's financial assistance for a utility bill. Sometimes it's I need food. So all of those are very common calls that we can help people with through
Yeah.
211. Through kind of looking for support services, we have a couple of programs in our office that do provide that specifically for kind of our older adult population. Somebody who is living independently in their home.
Yeah.
We want
Yeah.
to keep them living there, but oftentimes older adults will suffer from depression or
Mhm.
even possibly suicidal thoughts and not share that with anybody. They'll just isolate themselves. They won't talk with anybody. And so our program, our older adult outreach support program, is intended to work mostly through the phone because that's our area of expertise, is doing outbound phone calls and checking in with them, encouraging them, and supporting them getting reconnected in the community. Whether that's through a volunteer opportunity, whether that's through their church, whether that's through other family or friends, but kind of getting them out of their shell and then helping them overcome some of those depression symptoms they may be experiencing. And sometimes it's even just getting them back to see their physician that they've just decided not to go to the doctor anymore. So that's part of it.
Yeah.
So we do that. And then on the other side of that fence, there's always the caregivers. Generally, it's parents. Well, sometimes it's parents, sometimes it's the child taking care of a parent.
Sure.
Um, and so that's stressful because a lot of the caregivers don't live in the same town.
Right.
And so we're contacting that caregiver to say, hey, how are you doing? How can
Mhm.
we help
Mhm.
you take care of that person who's struggling, and offer them support and connection to resources? So we try to cover both sides of the
Yeah.
fence with that. And then I think some of the other programs we do, speaking of follow-up calls, we have this great partnership with the Department of Social Services and then our behavioral health systems in South Dakota. Is that when somebody is discharged from a psychiatric unit, that they had been admitted because they were depressed or had suicidal thoughts, that at risk time is when they're discharged. And so
Mhm.
we want to be there to support them. So when somebody's discharged, if they agree to the follow-up program, we will make outgoing phone calls starting within 24 hours to them, just saying, hey, you're back home now. How is it going? We just want to make sure you're doing okay. Have you reconnected with your family, your friends? What's next that you're going to be doing? And do you know when your next appointment is? For outpatient care, have you gotten your medications filled? Are your prescriptions, do you have those? Those kinds of things, just to make sure that gap between when they leave the hospital and when they connect with that outpatient
Mhm.
provider, that we don't let them fall through the cracks.
That's perfect. Do you ever see people not want to opt into that follow-up care?
Sometimes we do. The hospital staff are the ones who are kind of making the ask. They do a great job with
Yeah.
that to try to encourage people. But people do they can decline. They certainly have the right to decline that. Sometimes we see that with adolescents, but
Sure.
then the guardian has to sign off on it, the
Yeah.
parent. And so the parent's like, no, we're doing this. This is going to be good. And then, we usually, when we talk to the teen, they warm up to it and
Mhm.
understand that we're there just to help them and
Yeah.
it goes well.
Cool.
Yeah.
Um, Just a couple more questions for you, Janet. Thinking about systems, like the overall systems of care that are in place, whether that's law enforcement, healthcare, mental health,
Yeah.
whatever it looks like, how has your work with the Helpline Center informed your personal views and practices regarding mental health?
Um, I've been in this space for a long time, so I've been able to kind of see things evolve and change. And I think it's been, a very positive what I've been seeing. And so I feel really good about that. So I think when I started in this space, probably over 20 years ago, talking about mental health just wasn't, people weren't comfortable with it,
Yeah,
quite honestly.
yeah,
It's like just not something they wanted to know about or even bring up. And now I hear people are hungry for it, like they want to talk about it. So that's wonderful. And so with that, I think has brought kind of an influx of people seeking assistance. And so that's why I think we've seen this need for mental health professionals. And so now part of our job is to encourage young people to go into that profession. Like this is a really rewarding career to
yeah,
help people and make a difference in their lives. And so I think that we can adapt that. It's going to take us a little bit of time. So I think it's been positive. And I think the other thing that I've really liked is just this whole system and network and trying to connect all the
yeah,
providers in that space together, because I think together we can really make a difference for those folks who are struggling. And I think you just never know when one of us is going to struggle ourselves. We
yeah,
all go
yeah.
through dark times in our lives. And so we want to be there to help whenever somebody is struggling. And so I think the more of us that are in that space, the more we can make sure that one of us is there to help during that time.
Yeah, I love that approach. Putting aside all resources that are available or, resources that are possible but not quite available, if you could wave a magic wand and you could make all of the changes that you possibly could imagine, what would the mental health care system in our community look like?
Oh my
Big
goodness.
question.
Yeah, that is a big question. Wow. I think I would like to make it comparable to what people call as our healthcare system, that it really just should be one and the same. Quite
Yeah,
honestly, I
yeah,
don't, to me, it's just disingenuous to segment it like it has been segmented off, for decades,
yeah.
that it just needs to be incorporated and part of just healthcare in general. And that it's okay to reach out for help, whatever kind of healthcare issue you
Yeah,
have, whether that's a broken leg or anxiety. Like it's just part of, going through life and getting help and going through recovery. So that would be my vision, is
totally.
that there's just not this difference. Yeah.
I love that answer. I feel the same way. I mean, mental health is part of physical health. Physical
Yes.
health is part of mental health. It's all one and the same. So why is there two systems?
Right.
Yeah, I love it. Totally separate kind of topics here. Stepping away from 988, stepping away from Helpline, stepping away from mental health. Um, this can be totally unrelated. If there's one thing that you've learned in your life that you wish everyone else would know or could know, doesn't have to be related to mental health. What would it be?
You know, just in this, even the space of the work that I do, I think the one thing that I convey to people is patience. You
Um,
have to have patience, and you have to, in the sense that when you're trying to make change happen, it doesn't happen overnight. And sometimes that's a good thing because change is hard for people. So let's make incremental small changes to change the system, but that requires you to be patient
yeah,
and you can't have it happen tomorrow. And so I always encourage people, best advice I can give you is be patient, but also be persistent. Just because it takes a long time doesn't mean you can let up and, not continue to fight for the changes that
yeah,
you need, but you have to be patient.
that's perfect. And then lastly, is there anything that we didn't talk about today that maybe you thought that we were going to talk about, or anything that you want to add to the conversation about your work with the Helpline Center?
I think the only thing I would share is just that we look to everybody to help us get the word out about 988 because it is a relatively new kind of concept that if you have an interest in spreading the word about 988, please let us know. We have all kinds of materials available for free to like post a poster, to send out a referral card, because we just want everybody to know it's available for them.
Wonderful. All right, folks, thanks so much for tuning in today. So appreciate the listens. Janet, thank you so much for being on and sharing your work with the Helpline Center, sharing your work in the mental health field, sharing what 988 does. Just want to plug a few things. If you would just give us your website once more so our listeners have that.
Absolutely. Helplinecenter.org.
Awesome. And of course, 988 is 24/7. It is available via text, chat, and phone call. So reach out if you are ever in crisis or have a family member or friend that's in crisis as well. Until next time, stay well, stay resilient, and take care. Thanks so much for listening. Remember to subscribe, rate, and review Great Minds wherever you listen to your podcasts. For more information about Lost and Found, go to resilienttoday.org. That's RESILIENTTODAY.org. Follow us on Facebook, Instagram, Twitter, LinkedIn, and YouTube at Resilient Today. Until next time, do more and stay well.